Barbecue, music, cheering. It looks like a party. But this isn't just any party. These people gathered here to send out a message.
It was too long the day they shut it down, frankly.
The fixed needle exchange site here on Cormorant Street was shut down 2 years ago. To urge the government to open up a new fixed site, supporters of the needle exchange program gathered here at the Ministry of Health building to tell the government to say yes in my backyard to a fixed needle exchange site.
It's really frustrating because we're talking about community members. We're talking about people who are our brothers, our sisters, our family. We're not talking about some sort of population of people that are, someone other.
Currently, there is a mobile needle exchange program, but critics say that isn't enough to get people the help they need. The current program doesn't include counseling or other comprehensive health services.
It should not be the only access point for people who use drugs to be able to access the services and such, because it really misses that component of connection and that community space and that access to health services.
Critics are pointing fingers at the Vancouver Island Health Authority as well as the provincial government to do something. We tried to get an interview with VIHA, but no one was available today. VIHA has announced plans to open 4 secondary needle distribution sites, none of which are in the downtown core.
They've been talking about it for 10 years. Time to stop talking. It's time to start acting.
No one is taking leadership, and we're asking and demanding the same of the Ministry of Health, because they can step in and they can take action, but that no one seems to be seeing that this is a crisis.
The fixed needle exchange site had upwards of 2,000 clients, many of whom spilled out onto the streets. Harm Reduction Victoria says that was a problem, but that's why they need a fixed, larger, adequate needle exchange site.
If there was a fixed one, you would find even less paraphernalia on the ground around here. You'd find the streets much cleaner. You'd find fewer people in the neighborhood because there'd be a place for them to go.
The critics say the cost to taxpayers is bigger without a fixed site and harm reduction because there will be more disease transmission, which means a bigger healthcare cost.
There's no scientific debate about harm reduction, whether it be at the World Health Organization, at the UN, or at the European Union, or any international public health agency. There is no debate. Harm reduction services work, they're effective, and they're cost effective.
Harm Reduction Victoria says they'll be upping the ante to get the message out there. They have more rallies planned to get the message that there is a big need for a fixed needle exchange program. In Victoria, I'm Sucheta Singh, your health and wellness specialist.